Moving on, we're gonna talk about some guy stuff because this is a one-time
Bring it
only
on.
that we've had an all-guy crew, which I feel is probably terrible since we talk about a lot of women's stuff. Sarah, we
no.
miss you, but no offense, Robert.
Yeah, I get it.
No, but I thought we could talk about some more, men-oriented topics about plastic surgery. And the first one, which is the obvious one, is do men get plastic surgery? So, I'm going to throw out some data here. We're going to unpack all this. When we talk about these plastic surgery topics and we have these segments, it's almost always about women. It's almost always about
Good
women.
point.
And it's not necessarily true that women completely dominate the plastic surgery and aesthetic market. Now, they do kind of dominate it. So if you take everyone out there getting surgery, aesthetic procedures, it is 90%
Wow.
women, 10% men as of the latest data. And I guess, the first question, well, and second too, that number is shifting. I mean, it's getting bigger on the men's side,
Right.
but it is absolutely dominated by women right now as the primary consumers of plastic surgery and aesthetic treatments. And, I guess one of the questions would be, why is that? I think some of the answers are obvious. I mean, societal pressure on women, I think, is much higher completely unfair, but seems like societal pressure on women to have this, appearance
Absolutely.
is very high versus, men don't get that as much.
No.
I mean, we just don't. I mean, and I feel like I like to try care of myself, and I'm very kind of, into, putting my best presentation forward. But I don't get the pressure that women do.
No, I feel it too. I don't feel the pressure, but I think men, sometimes we don't care.
We just don't care how we look, women. Sorry.
It's true though. If you go out and look at some guys, you're like, man, does he have a mirror at all?
Yeah.
But it's kind of like going to the doctor. Who's the last one to go to the doctor? Men.
Yeah, man. We're just terrible on all fronts.
I'm fine.
Yeah,
we push through it, and it's all good.
And I think another obvious answer of why women are more into the aesthetic market is pregnancy. I would tell you that of the patients I do surgery on, the overwhelming majority are women who are kind of done having kids. That is the classic patient that I see.
Yeah, makes sense.
Because pregnancy, and I feel bad for women on this, pregnancy does a lot of things to your body that you can't fix on your own.
Yeah.
If you gain a little bit of weight, that's one thing. But like if your skin gets stretched out, your breast gets stretched out, your abdomen, your abdominal wall, there's nothing you can do about that.
Absolutely.
And so I think that women really kind of got the shaft on that one because, for us, we don't have to go through that.
Right.
And that's not the entire reason. I think the societal pressure is a big one. I think that those two are probably the biggest. But yeah, the percentage of men getting procedures is going up. And if you look at it now versus in 2000, so a little over 20 years, there has been a 30% increase. So that means, I guess, in 2000 it was probably 7% men, and now it's 10%. So we have seen a pretty significant jump in that. And every year it is going up just a little bit with men getting more and more stuff.
What do most men get?
We're going to dive into that, man. You were right on top of it. But I wanted to ask a question. And you guys don't have to answer if you don't want. I'm going to answer.
I'm not afraid.
I'm going to answer honestly. If I told you that you could go and have any surgery or procedure you wanted for free, and you had a 100% guarantee that it was going to go perfectly, and you're going to get a perfect outcome, would you have anything done?
So Magic Genie.
We'll say
he comes out and grants us the wish, right?
Yeah, but it's a procedure, right? The genie's doing the surgery or doing the procedure or whatever it is. So it's not like he's waving a wand. Like you have to go have surgery or procedure.
Right.
Like you actually have to have it, but you have a guarantee. One, it's free, so you don't have to worry about cost. And two, you're guaranteed to get fantastic results. Would you guys have anything done? And do you want me to go first or last?
You can go first if you want.
I'll go first. Okay. Yeah. So, I am kind of vain. Anyone who knows me will say that. I do like to take care of myself. Look, do you think this is natural?
100%.
Come on. And so, one thing I would do, I do take care of myself, so there's a lot of things I probably don't need because I'm a runner and I do that.
Right.
But I've always thought that maybe I could do like a little bit more on my jaw. You know, I don't have like a super strong jaw. It's not terrible, and I'm not like super self-conscious about it, but I have noticed it in like, you know, I like the people that have that Bradley Cooper jaw. You know, Johnny Depp, like that looks good, man. I wish I had that. And honestly, those surgeries are not really super invasive because most of the time it's done with like little implants. So that's what I would do. I mean,
okay, I like that.
Now, if you don't have anything or you want to answer, you don't
Travis
have to.
is like, I'm going last. I'm going last.
No, I'll go next if you want. I don't mind.
Go for it. Go for it.
So if I could get any surgery and I knew it was gonna be perfectly fine, it would probably be lipo.
Lipo, okay.
Yeah, it probably will be.
And we're
lipo.
going to talk about that for men because actually there's something about that makes that a little more interesting.
Oh, really?
There is. Yeah.
Okay.
Yeah.
Yeah, for sure. It'll probably be lipo. Like I'm a proud big boy. I love being a big boy, but for health reasons, I would probably want to be smaller, faster, in like a shorter amount of time.
Sleek.
Absolutely. Yeah, absolutely.
All right.
It's
Well,
the
I
case.
appreciate the honest answer.
Yes, indeed.
Robert?
Yeah, so I'm kind of in the same realm because I can go up and down in weight. You know, I don't have that wonderful genetics. I'll blame it on that. I mean, it's not me eating Bluebell. It's not that at all.
It's not the ice cream.
It's
and the
not
pizza
bourbon
it's not
at
the beer.
all. So yeah, just like that more healthy, something like that.
I appreciate you guys
long-term
giving an
being
honest
around.
answer,
Absolutely.
being real. I appreciate that. All right, so we are going to talk about the most I'm going to start. So I'm going to break this into two categories: the most popular surgeries for men. And this alters a little bit each year, so I mean, I can't remember what year I pulled this from. It was recent, but they may be off one or two. But I want to go through them. All right, so what do you? I hate putting you guys on the spot, but it's always kind of fun. What do you guys think the number one surgery, cosmetic surgery, not like Botox, but cosmetic surgery?
Botox, right?
Yeah, we're gonna talk about Botox. Oh man, I had a picture I was gonna bring and I forgot to bring it. Oh, remind me, Travis. Next week I'm gonna show this, even though it'll be a new show. There's a picture I want to show. Because somebody sent me the most amazing male Botox before and after, and I meant to upload it, and I totally forgot. Because it was really good. I looked at it, I was like, I'm going to get Botox.
Oh, God.
All right, but anyway, all right, what do you guys think the most popular surgery for men is? Number one. It's number one by a pretty big margin.
Yeah, that's a tough one. I mean, you've got calf implants, you've got...
What about like ab surgery?
Abs, I mean, does anything in... That midsection, that's what I was going to say, the nose.
Yeah, rhinoplasty.
The nose,
Yeah, rhinoplasty is number one.
Okay.
So rhinoplasty is number one. That makes up almost a quarter of all plastic surgery for men. Almost. It's like 22%. Second is blepharoplasty, eyelids. That's something I do fairly commonly on men, actually. I literally just did a blepharoplasty on a guy last week. So that's really common. Now, I will say that men mostly do it for functional reasons.
Interesting.
You know, because as the eyelid skin gets too much, it starts to obscure your vision, but it's still considered a plastic surgery. So rhinoplasty, blepharoplasty. Number three, I didn't believe. Number three, they said was cheek implants, which maybe that's jaw implants like I was talking about.
Well, just I mean, guess
cheek
defining...
cheek to me is up here. Maybe they meant facial implants because I just find it hard. And this was from the Society of Aesthetic Surgery, so this is like a pretty good list that I got.
Yeah.
It said cheek implants. I really feel like they meant facial implants because that would include everything.
Right.
And that would make more sense. Right. I really was scratching my head on that one. So number four was liposuction. Now, I want to tell you guys, because I'm a breast and body specialist, so I do tons of lipo. There is a problem with male liposuction, and this is something that most people have no idea about. So I'm about to drop some truth bombs on you guys, and I may like bust your bubble here if you guys are running out to get this free surgery I've been offering you. So women tend to collect fat externally, and what I mean by external is they collect it external to the muscle layer. So that means like hips, the tummy,
Right.
but it's external to the muscles that separate your insides from your outside.
So basically, it's just under the skin.
Yes, that's correct.
Okay.
Men are much, much more likely to get intra-abdominal fat. The beer belly guy typically will have a pretty normal fat layer on the outside, and they have a lot of fat in their viscera, their omentum.
Yep.
And I've had many men come to my office asking for a liposuction consult, And I go and I examine them, like, look, I mean, you may have a tiny bit on the outside, but like this belly is not necessarily, I can't get to it. Because if it's internal fat, you can't lipo that. I mean, you'd be poking holes in your bowel.
Right.
And now that's not always the case. And I've seen women who have a little bit of extra girth, and it was from intra-abdominal fat.
Interesting.
And then I've seen some men who do collect it more externally.
Yeah.
I think it's a hormonal thing. I really need to dive into why that's a thing, but I have found that to be true the overwhelming majority of the time. So it's a little bit harder to do lipo on men because a lot of times you can't get to where the weight is. Yeah. So that's one thing. All right, moving on. Otoplasty or ear molding, and a lot of that's done on kids. I mean, they do sometimes on adults. So, but the last one is one I do literally all the time, and probably the most common surgery I do on men, and that's gynecomastia, the man boobs.
You know what's funny? So Cindy Hermann is watching. And,
hi, Cindy.
I didn't know how to pronounce it, but I was going to give it a try, but you beat me to it.
Oh, gynecomastia?
She did say surgery for gynecomastia.
Yep.
And also the little Herman is watching as well.
Oh, Danica?
She's
probably really sad that I didn't invite her to come to co-host.
She says her and her friends are watching.
Next time.
So gynecomastia for me is super popular. It is a super, super common problem. A lot of men have this, and either they just don't care or they hide it.
Right.
But so for those who don't know, gynecomastia is when men get either the nodular part behind the nipple areola that's more like what women have, or the breast mound itself where they look like they have a female breast, or they can get both. And the cool thing about this is it is a easily correctable surgery. I think the satisfaction rate for the gynecomastia surgery I've done in my career is, I think, 100%.
Nice.
It is very easy to fix. The recovery is very simple, and the only downside is it is very, very tough. Not quite impossible, but very hard to get insurance to cover it. A couple of insurances will still do it. TRICARE, which is the military insurance, still does it.
good.
I know for a fact because I've seen plenty of service people for it.
Right.
But yeah, so gynecomastia.
On a lighter note, a buddy of mine used to try to work out his chest more. So his chest would be bigger, so his belly didn't look so big.
Oh, dude.
There you go.
We talk about that all the time when we do consults for mommy makeovers, which is breast surgery plus tummy tuck. Because people will be like, oh, I want to get these really big implants. Like, we have to remember, like, when we do the tummy tuck, this is all going to be a lot smaller, so it's going to make this look bigger. And you have to kind of counsel people on that because it does make a difference. Yeah, the biggest tree in the forest looks big or something. I can't remember.
Exactly.
All right, so most popular non-surgery treatments. Robert, what's the number one most popular non-surgery aesthetic treatment for men? Botox. My nurse is really hounding me to do Botox. I'm very kind of blessed. I don't have a lot of wrinkles, but I'm just starting. Look, you can kind of see them if you look. See it right there? Now, when I don't do that, they're pretty much gone, but you can almost see them. So I may try it. There is one thing with doing Botox on men, and this is a good thing to know.
Hold on. What would she say about me? I'm like,
yeah, you could use it.
We all could use it.
Everyone could use Botox.
Absolutely.
I make almost $0 on Botox. I'm not lying. The margins on Botox are super thin. But I'm telling you, Botox is one of the best things for staying young. And it's like cigarettes, man. That stuff sells itself. Like, you give somebody this stuff, and they're going to come back.
Right.
I just wish you made some money on it, because we don't make very much money on Botox. But it does get people into the office, and it makes people happy, and it looks good. So,
yeah, absolutely.
Botox. The problem with men. So, it is very common with a standard injection pattern of Botox to get an arched eyebrow. Okay, and women like it. Women manicure their eyebrows commonly to be arched, but men do not like it. And so if you are a man and you're going to go out there and you're going to get Botox, you need to make sure that your injector knows about that, because the quality of injectors is all over the map. There's people that are phenomenal, and there's people that I wouldn't give my dog Botox.
Right.
And so you just need to make sure, if you're a guy going out there, that they understand, if they're going to do your forehead, that you don't want an arched eyebrow look as a man. Typically, I mean, if you want that, go for it. I'm just saying, in general, it's not like a good look for a dude.
Right.
In my opinion, I mean, I don't mean that. Maybe some people like it. I don't know. Okay, the next most popular non-surgery is something I love and I do every year, and that's laser resurfacing. I love my laser machine. I talk about it all the time. I'm due to get it. I can't wait. I mean, it tightens up my skin. I swear I look 5 years younger after I do it.
On the face? Or?
Yeah, face and neck. Do your face and neck. It resurfaces everything. Like, people always comment on my skin after I get it. It's basically, I mean, it's not painless, but pretty much.
Like, it doesn't hurt, really.
I mean, you put numbing cream on, and your face burns a little bit. There's a little bit of downtime.
It is a laser.
It's a laser. I actually carved up a pumpkin with our laser one Halloween.
That's awesome.
So I really like laser hair resurfacing. Number 3, laser hair removal. I will admit I've done that before. I'm gonna probably give you guys TMI right now. That's not a manscaping thing.
Gotcha.
I saw,
no
but no, I don't like chest hair.
Okay.
I just don't like chest hair, and I don't know why, but I mean, I don't mind hair everywhere else, but like I used to shave my chest, and then I did
on
laser.
yourself or on
myself.
Oh,
myself.
sorry.
I don't care what you do, man. As long as your chest hair isn't reaching out and grabbing me. Like,
right.
So I did laser hair removal on my chest, and I really liked it. And the only thing is, you do have to. I did it probably 10 years ago. And I probably need to repeat it, but I mean, it lasted a long time. So I like laser hair removal.
I think we should have a skit or something, and you can do it on Travis and I and see how it works.
Laser hair removal?
Yeah. What do you think, Travis? You in?
Does laser hair removal hurt?
No, it doesn't. No, the light is warm.
Okay.
It's warm.
Okay.
But I mean, we do like women's, areas,
right,
yeah,
right.
and they do fine. So, and we don't have to numb it up. Like, you use a little cooling gel, and it's like, yeah, that's kind of warm, but it's not too bad.
Okay, got you.
Yeah,
I would try it. I don't mind hair, whether it be on my chest or whatever, but or like arms and all of that. So I don't really mind hair, but I would try it.
Yeah,
I would try it.
If you want it, I'll give it to you for free, man. It doesn't cost a lot to use it. So, okay, soft tissue fillers would be number 4. So that's like the fillers that women get, which I found that one surprising. That's
like
not
the lips and stuff.
Could be anywhere. Lips, nasolabial fold. I can see some guys doing the nasolabial folds,
right?
Because it does make you look younger. Lastly is microdermabrasion, which is just skin treatment. So anyway, I want to talk about the ones. I have 2 more things to talk about on this topic. One, what do I think are some of the best surgeries for men? I already said one. I think gynecomastia surgery is great. I mean, I guess because I do a lot of it, and I'm not saying that to drum up business. I just think they're cool surgeries. You can take something that a man feels super self-conscious about, which is having man boobs, and you can make that go away.
I bet the feedback you get is amazing.
It's good, yeah.
And so that's awesome.
I think eyelids are great for men. It's functional, it's cosmetic, it's pretty simple surgery.
Right.
Rhinoplasty obviously is a big one. I mean, for those people who want to have a better nose, rhinoplasty is great. Just make sure you go somebody who does a lot of rhinoplasties. I don't do them anymore. I just kind of got into my niche. I do think Botox is good. I'm kicking myself because I had a great photo. I'm going to show it next week. Make sure you tune in. I want you to see
Absolutely.
it. I'm going to have you moms get Botox. And then I love the laser skin resurfacing and the skin tightening stuff.
Yeah.
I mean, because it's not very invasive. It gives good results. It's not super expensive. And so I want to do, the final thing is there a good reason for men to have these procedures? I can think of 2. I mean, what do you guys think? I mean, I guess you probably don't have any problem with men doing stuff, right? I mean, you don't think it's girly? Would you think less of me if I went and got plastic surgery?
No, you do you. I mean,
that's how I feel too. I'm just like, if you want to have plastic surgery, man, go get it.
Yeah, absolutely.
But I have 2 reasons that are actually good reasons why men might consider it, and I'm not saying this to try and have people come out. So I'm just trying to look at all factors. One, there is a lot of research out there about the fact that people's self-image and body image do go up, and their self-confidence, which affects a lot of factors in their life, when they do a procedure and they get the outcome they want.
Absolutely.
That has been well documented in the literature. It can make a difference. I don't feel like you should go out and get something thinking that, this is going to change my life. That's the wrong way to go about it. But if you're like, hey, this one thing, my man boobs bother me, or I want these jaw implants, and you go do it, typically you're going to feel better about it. Like there's a very high possibility. The second one is ageism in the workplace. That is a real thing, people. There was a huge lawsuit against Google because they were pushing out men that were older, and these guys won a big lawsuit. And there's a ton of research to show that people who look younger either retain their jobs more, get more promotions, or just do better in general in business. And so, I mean, someone my age, if I was fortunately can't fire myself, but if I was in the corporate world, I mean, I might think about it more seriously because it does make a difference. So
yeah, absolutely. I mean, we all say, looks don't matter and this and that, but when you look at yourself and you have a little bit more confidence and you're happier, you're like, oh man, that looks good, or whatnot, then yeah, absolutely. That's going to boost your ego. And
all right, I want to do some quick recap of this segment. This is a quick recap on our segment about do men get plastic surgery? And the answer is yes, they do, but not quite as much as women. It's about 90% women, 10% men in plastic surgery and aesthetic treatments, although men are increasing each year as more men find that they might want to go under the knife or get some treatment. Some of those popular things men do are rhinoplasty, eyelids, sometimes liposuction, Botox, laser treatments. I think a lot of these are good. However, there are sometimes some certain things about those treatments that specific to men need to be addressed, such as Botox and how it might arch your eyebrows, or liposuction and is it internal fat versus external. So I think there are some good reasons that men might consider plastic surgery. One is there's a lot of studies that show that it increases their body positivity, their overall self-confidence, which does weigh into other areas, and also that ageism in the workforce is a real thing, and looking younger has been shown in studies to make you more successful at work as well. So if you want to learn more about that, watch the whole segment that we did on Do Men Have Plastic Surgery? So.